Your doctor might not tell you this, but this one free tool that I will show you will. I've learned that asking one simple question before accepting treatment can protect your body from side effects most people don't even think about. In this video, I will show you exactly how I do it. Hi, my name is Seth, and welcome to Forged Man of Iron. After years of battling with back injuries, chronic pain, fibromyalgia, central sensitization syndrome, and many other body dysfunctions, I've been rebuilding my body from the ground up and bulletproofing it from future injuries. I've learned that even though well-meaning doctors, they may not take the time to fully understand their treatment protocols and the repercussions and effect that it may have on you who have to live with it on your daily life. Today, I will show you one simple tool that helped me ensure that I got the right treatment last time I was at the hospital. So recently I went to the doctor because when I was power washing, I ended up hitting my hand when I was holding something while I was power washing it, and it injected water underneath my skin where there was a big old bubble that I could see. So ordinarily I would just dress the wound myself and clean it up, and I've done this with numerous cuts that were way worse than this power washer uh, injury. However, I ended up going to the doctor because I didn't want there to be an infection from bacteria being injected into my bloodstream. So I went there, but since I have Central Sensitization Syndrome and fibromyalgia, I was a little anxious because I know how doctors can be a little bit impatient. No fault to their own. They have a schedule and a deadline that they have to meet. So they're only there for a certain amount of time to give you the right treatment and then go. So when you tend to ask questions and question their treatment, sometimes they can be a little impatient. So I went in there and I told them kind of my past medical history because I've never seen these doctors before. And I told them that I need to check everything before I do anything because even the smell of concentrated Lysol sent my body into a fight or flight response because of my central sensitization syndrome, and I could not sleep. I was wound up for weeks. My body started to not work right. I couldn't work out the same that I could because my muscles weren't firing. These are the types of things that I have to deal with my nervous system issues. So I told them that, and it was like it went right over their head because as soon as I started asking them more about that, they're like, "Oh, it's fine." And so I just cautioned them again. No, if I use anything, it's going to mess my body up for weeks, and I'm going to have to go through a lot of pain to recover and be able to recover from that. And so I started to ask them about the ingredients of the cleaning solution that they had. And just a few of them that I saw on the back of there was like a red dye, a fragrance that really just didn't even need to be in there. It's like, come on, it's a medical product. But I ended up taking a picture of it because there was a lot of ingredients that I didn't even recognize it, and I just sent it in to ChatGPT, and I asked that ChatGPT, would any of these ingredients make my central sensitization syndrome go off? And so it was really helpful because it was very clear about how high of a risk on, like, we could say 1 to 3, low, medium, or high, each ingredient was. And so there was quite a few ingredients in there that would probably set my body in on edge and cause me a lot more pain if I just went with their recommended procedure. And generally doctors and hospitals, doctors are just following a treatment protocol based off the clinic and the standard operating procedures that they have in the hospital. So they're not really customizing it for you. And so when they gave me that, I declined it, and then they were going to stitch it up, and I said I didn't want any numbing agent. So they insisted that I get it super glued because they didn't really want to stitch me up, and they said it wasn't, the severity wasn't bad enough that they're really concerned if I got stitches or not. So they ended up giving me a super glue, and I sent that in to ChatGPT too. The first one they gave me had a lot of harmful ingredients. The second one that they gave me was it had nothing, and I'm guessing that the first one they gave me was cheaper. I don't know, but that's just my assumption. In the end, I think that they were really happy because of the fact that with ChatGPT, I wasn't looking up every single ingredient before I used something, but it was really fast. And because I was very clear in my expectations from the beginning, I think that they appreciated the fact that I was taking my own health into my own hands and becoming being responsible about it versus just accepting their treatment that they just give to everybody else. So in the end, it actually turned out really well. What I've realized through going to various different doctors numerous times is that every single clinic that you go to, they normally have standard operating procedures. If you have these symptoms, then they give you this treatment. And they may have even a few that they can choose from depending on what they think is best, but it's already pre-written out. And then so that they're not actually taking a ton of time thinking it through. And then based on your experience, how many times have you gone to a clinic and they actually thoroughly think about all the different problems that you have, not just the one that you're going through at that time, but your whole medical history, because everything plays a part. Your body is a whole unit, it operates all together synergetically. So when you think about going to a doctor like myself, normally the nurse would ask me a ton of questions, and then the doctor would come in and ask me not only the same questions that the nurse did, but the questions that they asked me last time I was there at the clinic, which may have been just the other week. And so it shows that they don't actually review their notes before I go in there. So they're not coming up with a critical thinking approach where they're looking at all the information, but really just trying to give me a treatment based off what is the information I give them right then and there. And so a lot of the time it's the time and restraint that they have out of no fault of their own. They got a busy schedule, they're pushed with so many different appointments here and there. But in the end, you are left with more side effects from a treatment that may have not worked. And even if it did work, if you have side effects from it, then is it really better than the alternative? A lot of the time it's just a trade in for another problem. So with this approach, you can really take your health into your own hands and make the decision yourself, because in the end, you're the one that's going to have to live with it. You're the one that's going to have to deal with the pain in and out, and it's going to affect every single part of your life if whatever types of things that you're doing. For me, raising two children, it matters a ton, because if I'm not able to function correctly, then I cannot take care of them very well. And I cannot actually be there and play with them, because having two toddlers, they don't understand when you have back pain so much that you cannot move, you cannot bend over to pick up a toy, that you can't even hug them without excruciating pain. They don't understand that because they see you as their superhero. I realize that most people don't even know that they can ask their doctors questions, let alone asking to see the ingredients on whatever type of medication or other medical supplies that they're giving them. A lot of the time, it can be unpleasant, and I've had it in situations where doctors, if you're asking them questions about their treatment, they may feel like they're attacked and defending themselves. And basically, why are you asking me all these questions? I've been to school for 10 plus years. This is the type of feeling that I got as a patient asking many other doctors questions about the treatment that I have to receive. But in the end, they're going to go on to the next patient. But if I do not do my due diligence and actually accept the best treatment, then that's going to affect my life and every single day that I have to live that life. So here's a simple thing you can do to use ChatGPT. Is the first thing is, if it's not an emergency, and even if it is, you may be in a waiting room at that time, you can do this as well, is the best thing is to give ChatGPT a very well done descriptive prompt. The one I would use is, I'm going to the doctor for the following problems. I am currently taking blank medications. I have been diagnosed with in the past. I have allergies too, and any other helpful, relevant information you could give to a doctor would also be here. So the last thing I would add is, please update your memory with the following information, because that way now you are training ChatGPT to be your assistant who knows these things for any future questions that you may ask it. So it's not going to forget your medical history. So when it gives you medical um, advice, maybe like if you have a certain symptom, you could ask ChatGPT, I have these certain symptoms. What may they be a cause of? And you don't use this as a tool to replace your doctor, but rather for yourself to educate yourself as a patient on the type of issues you may be dealing with, so you can better understand him, so that you know how to better help yourself. Because in the end, it's not your doctor who's going to be following the treatment protocol, it's going to be you. So it's better that you understand these things anyways. So by using this prompt beforehand, it will allow you to be able to easily go into the clinic, and after asking for the ingredients, simply taking a picture and sending it to ChatGPT with a follow-up question. Is there anything in here that may make my symptoms worse or harm my body? That way you're at least able to know, even if there are some harmful ingredients in there, whether you want to take them or not. That way you are not blindsided by the side effects that you may receive. I'll go ahead and post this ChatGPT prompt in the video description, so you're very easily can copy and paste it into ChatGPT yourself. Please let me know, what kind of health problems are you struggling with? Are you still banging your head against the wall, not knowing how to heal your body? Like I was countless times, regressing, taking 5 steps backwards and 2 steps forwards constantly, and not knowing if you'll ever see the light at the end of the tunnel. I'm here to help you with however I can, because since I was at such a low position, I would like to help at least one more person, and it would be worth it to help them to get out of pain so that they can live life on their own terms. If you found this video helpful, hit the like button. And if you're interested in learning how to build true strength, bulletproofing your body from future injuries, and living life pain-free, hit the subscribe button. And I'll be putting out content that will help you on your journey to forging your body of iron.